The elderly population or the geriatric population, as we say, the ones who are 60 plus or 65 plus, they will be always at a higher risk to develop any infections, any diseases. Now, usually you see these elderly populations will also have other comorbid conditions with them, like they would be diabetic, they would have high blood pressure, hypertension, they would be having a pre-existing cardiac disease or a heart disease. Some of them would be having a kidney disease or a liver disease or a pre-existing lung disease, as I have discussed earlier, like might be suffering from COPD or asthma. So all these people, they would be more vulnerable to any kind of infection. In this pandemic situation, these people will be more prone to catch the virus, and they will be manifesting usually the moderate to the severe form of the disease in usual terms. So few things has to be remembered here very carefully. One, the elders must not discontinue their treatment for their regular problems. Their diabetes must be kept under control, their blood sugars, blood pressure must be monitored, and it should be kept under control. If they are taking any medications for their cardiac problems, for their lung problems, all those medications must be continued. Now, at the same time, they must also undergo regular follow-ups with their doctor. Just because there is a disease called COVID-19, it doesn't mean that the other diseases have vanished, because the other conditions will continue to have its manifestations in its own way. So those diseases needs to be kept under control. Now, of course, there is a phobia, there's a concern of the elders going out and catching the virus, or going to the clinic environment and catching the virus. So this is where I think telemedicine can come into practice, and it can be used, and we are using this in our clinical practice to take care of these chronic metabolic disorders of our elder population, where using video call or audio calls, they can connect with their doctor and get their prescriptions revised, and then get their correct drug dosing. If these elderly populations are picking up a COVID infection, it is very important that their monitoring is done during this period. So here also telemedicine monitoring will be required for any elderly population who is developing the COVID-19 infection, even if they are in the milder form. Because you see, COVID, as we have known, is a disease of time. So time is a very crucial factor in COVID. So usually we see that the deterioration or the worsening of the symptoms, as we know, the breathing difficulty, the chest tightness or heaviness, the drop in oxygen saturation, which people are very obsessed about. These are the symptoms which usually develops after 7th or 8th day of the illness. Okay. So it is at this particular point of time that the monitoring is properly done at home, for all age groups, but especially for these elderly people, because obviously they would be more prone to develop the severe form of the disease. And we always recommend our patients that if there is an individual who has developed COVID infection and is not getting a proper monitoring at home, whichever logistic failure it is better you shift the patient to a hospital for isolation monitoring, because when they deteriorate, they should be identified at the right point of time, and proper treatment, antiviral injections or steroid injections or even oxygen therapy and whatever needs to be given to those individuals can be given at the right point of time, because that window is a very fine window. Especially if these people have got diabetes or a kidney problem, their prognosis usually becomes pretty bad, because they have a higher chance of developing the complications as compared to the other non-vulnerable population. So for elderly people, it is very important to keep their regular diseases under good monitoring. And we also recommend the influenza pneumococcal vaccinations on a routine basis now for our elderly population, because we believe that besides the COVID pandemic, the influenza, pneumococcal pneumonia, these would be super added infections in them, and that can be actually prevented by giving the vaccines. So besides that, elders must maintain hand hygiene, and if they must not usually go out of their house unless it is absolutely necessary. Even though we are 9 months into this pandemic and we see that people are a bit relaxed these days and going to invitations and marriage ceremonies and just going for a small outing, I would recommend the elders to still stay at home. If they at all have to go out for some bank work or for some essential work, they must be wearing their masks properly, maintaining hand hygiene to the best possible measure, and stay limited time outside only.
With a network of over 11,000 doctors, avail quality healthcare services 24/7 on CareClues. Book your online or in-clinic consultation today. Thanks for watching. Don't forget to like, share and subscribe.